Do you ever wonder that some of the prescription medications that you're on could be completely wiping off all your weight loss efforts? In this video, I'm going to tell you about these 5 classes of prescription medications that are actually burning a hole in your pocket and are also making you overweight. Do you ever feel that on your journey to achieve your optimal weight, there are things that you may be doing to yourself that are actually hurting you more than helping you achieve your eventual goal? Well, in this video, I'm going to be talking about these 5 classes of prescription medications which have weight gain as a known side effect. But before I go further in this video, I want to make a clear disclaimer that please do not stop any of these medications without medical advice. Always read the label and ask your doctor for alternative medications that will still help you take care of the health condition for which you are taking these medications, but also hopefully reduce the side effect of weight gain. I'm going to go through with you in this video 5 categories of prescription medications, but the one that I mention at the end is actually going to surprise you. So stick with me, and here I describe to you these 5 classes of medications that have a known side effect as weight gain. The first category is that of antidepressants. In this category of medications, you include things like antipsychotics or mood stabilizers as they are called. Some of their names I will mention over here for you, things like fluoxetine, also known as Prozac, sertraline, also known as Zoloft, or escitalopram, also known as Lexapro. There are also other antipsychotic and mood stabilizer medications such as olanzapine and risperidone and the likes, which all have a side effect of weight gain. Now, the surprising thing that I find is that when individuals are taking medications for depression, such as these antidepressants, they gain weight, which makes them feel even more depressed when they look at themselves in the mirror. When you fix the weight, their depression gets better. That is what we see in all the weight loss surgery or people who have done non-weight loss surgery programs and have achieved successful weight loss. The second category of drugs is steroids. Now, steroids are commonly used for autoimmune conditions, for conditions of, say, lung fibrosis and other related conditions, even allergy conditions, and for gut-related disorders for inflammatory bowel disease such as Crohn's and ulcerative colitis. Now, some of the commonly used brands of steroids are those of bedanoside, which is also called Symbicort, prednisolone and methylprednisolone. And the reason why steroids lead to weight gain is that they create fluid retention by way of retention of sodium. And that is what creates fluid to be retained in the body. And more importantly, if steroids have been used for a longer period of time, they create fat distribution or redistribution in the body, leading to a preferential deposition of fat in the middle part of the body, which is what leads to a condition called as truncal obesity. The next category of drugs is antihistamines. Now, these are used for allergic conditions, mostly rashes, hay fever, and things like that, such as cetirizine, also called as Zyrtec, or Allegra. There's another very commonly used antihistaminic medications, and the way they bring about their side effect of weight gain is by turning off the hunger signals, and this is what leads to weight regain. The fourth category is that of diabetes medications. Now that would sound very counterintuitive, that diabetes medications, specifically insulin like Humalog, Novolog, and some other categories which is called sulfonylurea such as glipizide, these are the medications that actually cause weight gain because of their insulin-like effect. Now, insulin is a hormone that promotes growth in the body. It causes glucose or sugar to get into the cells, and the cells then convert this glucose into fat. And this is where it is important that if you are a type 2 diabetic, then your body is already making enough insulin. You do not need to take additional insulin because that causes weight gain. By adjusting your diet and your lifestyle and making changes in your exercise routine, you can get off the insulin. This is a situation where you need to discuss this with your treating doctor and maybe consider alternatives. Type 1 diabetes is a situation where your body has got no insulin, and that is where you need insulin. But even there, weight loss helps you in improving your diabetic status and maybe reducing the requirement of insulin. The fifth and the most interesting category of medications that can create weight gain in the longer term is antibiotics. Now, antibiotics leading to weight gain is a very interesting topic. I base my information on two large studies that were published in 2018, and these were studies done in children. And what they found was that they had a 5-year follow-up of over 362,000 children who were on different kinds of antibiotics, penicillins, cephalosporins, or other broad spectrum antibiotics. And what they found was 58% of these patients were on single antibiotic, 35% of these patients were on 2 antibiotics, and at least 16% of these patients were on 4 or more antibiotics at different periods of time. And what they found was that at 5 years follow-up, 28% of these patients were either overweight or they were obese. Now, these were kids who were 5 years of age. Imagine what happens when these kids grow up in an environment where there is processed food, poor lifestyle habits. It only leads to amplification of the problem of obesity. So, I hope you found this video useful. Once again, do not just stop your medications, but go and discuss it with your doctor and consider some alternatives. If you like this video, please do subscribe to my channel and share it with your friends and family members who may benefit from this video.